Hello, welcome back to Little Growing Bonds. Today we'll talk about something a little different. I was in the Philippines a while back and had the chance of meeting some really amazing pediatric orthopedic surgeons, and of course I couldn't resist the chance to strike up a conversation with them. They were all really passionate about what they do, something I must say is common among us, many pediatric orthopedic surgeons. I met up with Dr. Bryson, a pediatric orthopedic surgeon from Tanzania, and we had a good chat. Stay tuned to find out more. Hi, how are you?
Fine, how are you?
I'm okay. So, tell me about yourself.
Bryson Mcharo. I'm a pediatric orthopedic surgeon working at Muhimbili Orthopedic Institute, Dar es Salaam, Tanzania. I've been in practice, as pediatric orthopedic surgeon for more than 10 years now. Yeah.
Nice. Conditions. What are the most common pediatric orthopedic conditions that you have to deal with in your setting?
So the commonest condition, pediatric orthopedic, that we are seeing in my hospital range from, trauma, non-trauma, infection, and non-infection. But the commonest that we are seeing, if you start with the congenital anomalies, is club feet. And but the child grows, as far as foot is concerned, we see, a lot of, pes vulvus. We see a number of, of course, rare cases like, congenital verticillars. But, as child grows, we see a number of patients with bowed leg. And we see also some of the children who present with limping because of the hip problems, and few with, spine problems such as scoliosis. But we see a lot of traumas. When I say traumas, I mean, fractures of the upper limb and lower limbs.
Okay. Which are the ones that give you the most trouble as those conditions that are really hard to manage, in your opinion?
So the one that really gives us troubles, these are the condition, like fractures, where the patient comes with fractures, and that some of them needs, urgent or emergency care. But there are other conditions such as, developmental conditions and some of congenital anomalies where, parents, but even the caregivers are worried, like, this child is going to be normal, this child is going to be like other children, and parents ask a lot of questions like, is my child going to be, like other children? Are they going to go to school? Things like that. So in such a situation, sometimes as a doctor, you're also worried, like, is this what I should tell the parent? Is it true that my child with cerebral palsy, is going to have another stage, like, as far as growth motor, scoring is concerned? So those challenges, to give the parents the assurance that your child is going to be normal, in those circumstances, as a doctor, sometimes they give you, dilemmas.
I can see why that would be hard to deal with. So actually talking right about that, how I understand many people don't want to do pediatric orthopedics because they have to deal with the parents. How do you deal with that?
I like children. So that really doesn't give me a problem because that has been part of my passion. And one of the things that gives me hope, when you take care of these children, is the outcome that you get of them. Children, heal quite faster, and they're lovely, and it's good to see somebody is growing out of your hand after so much, struggle and something like that. Okay. So that alone gives me hope. It
gives you the courage to just keep working on, carrying on. Okay, so third question. What are the biggest challenges you face in management of pediatric orthopedics in Tanzania?
So the biggest challenge that I face is when a number of children presents, late to the hospital with a condition which, if they could have, come earlier, they could have been much better. They could have, get, better prognosis. But the other thing is, the disparities. It seems, children who are in the villages probably are deprived of, their rights to get the proper pediatric orthopedic, care. So that gives me headache. It's something that you wish if any child in Tanzania or all over the world could have an access to the best, treatment of, pediatric orthopedic.
Yeah.
So that's something which is giving us, headaches, and probably that's why we're here in this, conference, trying to look into how we can solve that problem of disparities as far as, pediatric, with orthopedic condition care is concerned.
Yeah, that's very true.
Mm-hmm.
That's very true. And finally, so tell me one thing on your pediatric orthopedic bucket list.
So one thing that is in my bucket is at least one day to have, these services all over my country.
Yeah.
Where every child has the right to get, the right service at the right time with good outcome. So that's what is in my bucket.
As simple as that, and yet it's very, like it carries volumes. But we keep hoping, and I know we'll make it.
Yeah.
All right. Is there any question that you wish I'd asked that I've not asked you, or any question you'd actually want me to?
I have many questions.
For me or for yourself?
For you.
Okay.
So, what's the situation in Uganda?
The situation in Uganda, like in very many low middle income countries, is known the best. One, we have very few pediatric orthopedic surgeons, so therefore the service is not readily available for everyone. It's fortunate that most of the other general orthopedic surgeons are able to offer the service, but there's some conditions that clearly require a pediatric orthopedic surgeon, and we're not there yet. Still like you've mentioned, for your case, we have very many children who still present very late with conditions that are easier to manage when they are younger. So that's still a big challenge in our setting. There are very many more, but those are the ones that I can sort of think of that are the biggest challenge at the moment.
And do you think Tanzania and Uganda orthopedic surgeons can work together as a team,
yes,
to come up with something which can be valuable to all of this?
Very, very much so. In fact, that should be the goal. We're neighboring countries. We're all part of East Africa. We should aim towards working together for lack of a better word, to try and improve the services to the children. Because at the end of the day, we just want the children to have better lives, improve their quality of life. And we can do that, if we partner up and give these kids and families the best care possible.
Sure. Thank you.
Thank you too.